The prominent energy system that will be active during a cool down is the aerobic energy system. The aerobic energy system is a system that uses fats and carbohydrates for resynthesizing ATP for energy use. The aerobic system produces far more ATP energy than the lactic acid energy system and the ATP-PC system. The aerobic energy system will allow the individual to be able to hold certain stretches and partake in the cool down phase by using fats and carbohydrates as energy that is being released into the body as it is required. In a cool down, the body is trying to return itself back to a level of homeostasis, whether this may be the decreasing heart rate or releasing sweat to return the body to a normal temperature. As a result of constant stretching, which is also referred to as self-myofascial release, the muscle that is being stretched is able to release tension that builds up in the muscle, which when touched can be very tender. Self-myofascial release aims to restore tissue integrity of the muscle and also aims to restore normal function and movement back into the muscle. Adaptations that occur due to constant stretching is a feeling of looseness and releasement of tightness that is built up and an increased level of range of motion. This happens through the self-releasement of trigger points in specific areas of the body. For example, a tight hamstring could be inhibiting the individual's range of motion in an exercise such as a stiff leg deadlift. Hence, to increase the range of motion in that particular exercise, stretching the hamstring and self-myofascial release work will be able to do this. In a cool down scenario, it is important to stretch because during a workout, lactic acid builds up in our muscles, giving us the sore feeling in our muscles. It is immensely important to stretch our muscles after a workout to reduce muscle fatigue and soreness in the preceding days, where DOMS begins to kick in. Adaptations that occur as a result of constant stretching before and after a workout could be that you are now less susceptible to injuries as you are taking the time to warm up and cool down in your sessions, so muscles are prepared when they need to be, and are also getting the stretch they need at the end of sessions to help with recovery. During their stretches, the two major joints that would be used to move would be the hip and the knee. So firstly, I'll speak about the hip. So the range of motion, according to the American Academy of Orthopedic Surgeons, through flexion is 0 to 120 degrees and extension is 0 to 30 degrees. So the agonist muscles that are being used during hip extension and hyperextension are the gluteus maximus, gluteus minimus, biceps femoris, semimembranosus, and semitendinosus. During hip flexion, the agonist muscle that is used is the iliopsoas. During hip extension, antagonist muscles include the psoas, iliacus, tensor fasciae latae, rectus femoris, anterior adductors, and sartorius. During hip flexion, the agonist muscles that include the gluteus maximus, biceps femoris, semitendinosus, semimembranosus, and the posterior head of the adductor magnus. So the stabilizers that will be used during the stretch would be the deep rotators of the hip, which acts as the stabilizer. So different muscles of the hip that will be used during the stretch will be the gluteus minimus, the adductor magnus, the sartorius, the tensor fasciae latae or the TFL, and the semitendinosus. So speaking about the knee joint now, the range of motion of the average knee flexion according to the American Academy of Orthopedic Surgeons is 0 to 135 degrees in flexion. So the agonist muscles that are being used during knee extension include the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedialis. And during knee flexion is the biceps femoris, semimembranosus, and the semitendinosus. The antagonist muscles that are used during flexion are rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius, and the extension is biceps femoris, semimembranosus, and semitendinosus. The stabilizers of the knee are the IT band, the quadriceps, popliteus, the biceps femoris, and the semimembranosus. And the different muscles and origins and insertions of the knee, so we have the rectus femoris, we have the vastus medialis, the vastus lateralis, the vastus medialis, the biceps femoris, and the popliteus. So here we have to make completing a glute stretch. So I'm just going to ask you to put one leg on top of the other, just on top of the other knee. Perfect. And now just bring your foot onto the box, your left one. Perfect. Yeah, right there. You should be feeling a nice stretch through your right glute. So just raise your right leg just a little bit higher with your foot. Yep, so just pull your right leg up and just hold it with your hand. Perfect. Should be feeling a nice stretch through your quad. Excellent. And the other leg.